Good afternoon, I'm Joel Edwards, the CEO of True Recovery here in Newport Beach, California. I'm joined today by Dr. Alejandro Alva, who is the founder and medical director with PNS, which is Pacific Neuropsychiatric Specialist here in Orange County, as well as Matthew Kinoshita, the clinical director of True Recovery. I'm going to ask these two to join me today to talk about what we're all going through right now with this whole pandemic of COVID-19, substance abuse issues that our country and the clientele that we work with are currently plagued with. I really wanted to have you two chat for our viewers to see the medical side of things and what you're seeing, Dr. Alva and Matthew, with what you're seeing from the clinical and more therapeutic side, but stepping away from those two traditional modalities you guys work in and looking more at the holistic approach to the medical and the clinical side. Have things changed, kind of get you guys' perspective on what's working, what's not working, ideas you may have for our viewers to kind of incorporate new holistic approaches, both the medical and the clinical side. And so, Dr. Al, I'll start with you. Kind of what are your thoughts on that right now?
Thank you, Joel, for inviting me. It's always a pleasure to talk to the both of you. You know, it's interesting that you mentioned that because things have radically changed. And I know I'm going to date myself, but about 12, 15 years ago, there was no dual diagnosis. There was basically, we're going to treat the substance use disorder, or we're going to treat the psychiatric concern. Nowadays, we have a more holistic approach. We have the whole treatment team approach. And that treatment team approach encompasses everybody. It starts with the client, the patient, because they have to be empowered to be able to take care of their needs. They have to be their own advocates. It encompasses the psychotherapeutic approaches, where, people have anxiety, they have depression, they have PTSD, they have a number of different things, and there are different behavioral, cognitive behavioral, or other modalities that can help to get them back to where they need to be. And of course, there is the medical portion, and we do take care of both the medical concerns and the psychiatric concerns. I think that approach is incredibly important because that's what empowers a person to change.
Thank you, Dr. Alva. And Matthew, what have you seen over the last 8, 9, 10 months with the pandemic and this kind of approach to a holistic way of treating our clients that are struggling with their substance abuse or mental health in light of the pandemic that's going on?
Yeah, I think it's a great question, Joel. I think initially when all of this started, we saw a great deal of fear. Right. And I think that would be expected with the unknown of what are the effects of all of this, am I at risk, and what else is going on. And then as we've moved through all of the care that we've provided to the clients, I think the main thing that I've seen actually happen is a lot of creativity. Okay. People realizing that, gyms may be closed now, so what can I do to get out of my space, get a little bit of exercise, get some fellowship. We went to a period of time where everything is being delivered via telehealth, and that is our own programming in addition to any outside meetings of supportive recovery that we are engaged in. So then we had to get everybody used to that, and people got used to it. I think as people, we are flexible. I think when we're supported, we're able to learn and continue to see the value in a lot of these different things we're doing. And when you ask the question about, what is the holistic approach to doing this, I think the key, as I've seen, is really this creativity, this ongoing, consistent support, and then allowing ourselves to still have that connection. And through all of that, I've seen that, honestly, not much has changed. I think your average situation with somebody comes into addiction treatment, to be quite honest, at this point now, I don't think they're very afraid of the pandemic concerns. They know they're in a safe place. I know people that are coming into a health treatment facility such as ours are being tested. They're, even though they're living amongst others, they know that within that confines of what we're doing, I think they actually feel safer, to be quite honest. And so I think that we've kind of hit a stride. We had to deal with the challenges initially, right? But I think we are really doing a lot of good work, and I think that initial fear was removed in a lot of what we're doing.
If I might add, I think it's a human connection that makes a difference. Think about the fact that when people are in their addiction, they isolate, and when they engage with somebody else, it's not a very productive type of engagement. So when they come in, they have hope. They have hope in the fact that somebody else has the same problem. and they can actually look at somebody else and another human being and understand that there is that opportunity to change. Regardless of the pandemic, I think that once the folks understand that there is the safety concern that is being addressed,
Right.
they come in with that hope and with the understanding that maybe today I can do things differently. And what I've seen in the facility all the time is people are creating connections with other human beings. They're creating friendships. I had one of the boys tell me, I'm a loner, but I like so and so and I like so and so. I can relate to them. And I go, well, you told me that you didn't like anybody. He goes, well, they're like me.
Right.
And what did that teach you? It teaches us that we're not as unique as we think we are. We have a human connection, and that human connection is what we're trying to nurture here.
So, something interesting that you both brought up in your separate response to that question had to do with the concept of telehealth or telepsych, or just the delivery of our services via telecommunication, whether it's a HIPAA platform or Zoom or something along those lines. And on the one side I hear, hey, it's important to have this personal interaction. On the other, it's hey, we need to create this environment that's safe, and for some that helps relieve that anxiety, like I can stay in my home where it's a safe environment. So as we've talked about these changes that have happened, and I'm sure you both agree that there's some changes that have happened that will continue as we move forward, as kind of the new normal, and telehealth probably being one of those in some way, shape, or form. How do you see kind of telehealth moving forward with respect to treating patients medically, clinically, and part of this holistic approach?
Well, I think that telemedicine is here to stay. I've had divergent opinions on this with regards to different patient personalities. I have, especially my older patients that I've known for a long time, they tell me, hey, Dr. Alva, you don't even have to do the telemedicine thing. Give me a phone call. And I'm like, wait a minute, no, I want to see you.
Right.
Yeah, but I'm doing great. Are you sure you're doing fantastic? Yes. Okay, fine, I'll give you a phone. Because sometimes they're technologically challenged. They don't know how to do it, but they know how to pick up the phone and they feel connected. And again, they feel comfortable with telemedicine because it's convenient for them. And they feel safe. And I have other patients that basically tell me, look, doc, I just want to see you, dude. I don't care. And I'm like, well, you should care. And, and they do come into the office and we do see them in the facilities, as long as the regulating agencies allow us to do it. Case in point, 2 weeks ago, we were seeing patients live in the office and we were seeing patients live in the facilities. And then the county basically said, no, let's go back to telemedicine because of safety concerns. So I think that what is going to happen is that we're going to have a hybrid where people are going to pick and choose what fits their personality and their need better.
You're seeing similar to that or a little bit different?
I feel that it's been, I definitely agree, first off, that it's definitely here to stay. I think what has happened is it's kind of accelerated this entire process. I feel like there were people kind of touching on it and people not necessarily feeling like it was a fit.
Right.
But then when we were forced to do it, my experience was that people actually thought it wasn't that big of a deal. The biggest challenge that I've encountered is group facilitation certainly has a different feel.
Sure.
Because you got people scattered throughout, almost like that montage in the beginning of the Brady Bunch,
Yeah.
It kind of looks like that. But the one-on-one sessions, for sure, I don't really feel there's that much loss. I actually feel that the person who's sitting across from you, even if it is virtually, you're able to still have that connection. You're still able to have the same conversation that you would ordinarily. So I feel that it's been an adjustment, but I don't think there's been a whole lot lost. And I think that we also, as a facility, have dialed it in. I mean, we realized this is a better way to deliver curriculum, or we can, when you begin to master all the different things that you can do with these platforms, I think it's been a pretty effective way to do work.
So, I know the term holistic and wellness and all that gets thrown around a lot, has been for a long time, especially in the last, 8, 9, 10 months. When I think of holistic, I think of this multi-pronged approach and the team approach you talked about, and trying different things and getting creative, but I also think about, the body and exercise and nutrition and the spiritual component, we're outside in this lovely late December, 70-degree weather. Not everyone's as fortunate as that, but the idea of getting outside and communing with nature is part of that self-care component of a holistic approach. So when I kind of talk about and bring that up, what's that bring up for you, Matthew, when you're looking at your client and assessing him or her from a holistic approach and kind of incorporating those pieces into his or her kind of next step in treatment plan?
Yeah, I think it's a really good question, because anything that I'm trying to achieve, I'm trying to make sustainable.
Right.
So where I always start is I want every client to be heard on an individual level. I want to get to know them. Like, what are their interests? Where are they from? What are they used to doing? What really captures their attention? Because if I can get them to really grab back onto that, the other stuff begins to fall away. All the other anxieties they had, all the other fears they had, all the other concerns, they almost get to know themselves again, right? So I'm very, very focused on that. We're blessed to be in an area where we can do so much. The weather is not going to be a factor. The colds might get, sorry for the rest of the country, it's about 50 or so we're blessed. And everything that we do, when we think of this approach, I really look at it as, if you look at it from a limitless perspective. That's what I try to impart upon the staff and the clients. Whether it's music, art, being outside, we can do all of that. And so I'm always going to be bringing that to the clients in a way to get them re-engaged with their lives.
Great, thank you. And Dr. Alva, for you, from the medical side, you probably deal with things a little bit differently, because oftentimes there can be some medical restrictions and those things you have to kind of incorporate in the treatment plan. But what are your kind of thoughts or modalities surrounding incorporating more experiential / holistic approaches that we just kind of talked about?
I completely agree with Matt. I think it's all about mind, body, and spirit. People ask me, why do you have success with your patients? And I just try to be legitimate. And the way that you become legitimate is to take into consideration their needs and concerns. Adolescents, I love them. Parents, not so much, because they can be difficult. But, adolescents are hard. They're like, I don't trust you.
Right.
And my answer is, you shouldn't trust me. I just met you. But I'll tell you what, and this is what I tell all my patients, I'm not here to tell you what to do. My job is to give you the best medical assessment that I'm capable of providing, and I'm going to give you options. And I'm going to give you the good, the bad, and the ugly, and then you're going to make up your mind as to what it is that you want to do. So with regards to how we handle medications, I give them choices. And then of course I'll make a recommendation and I'll give them a reason why. But the other thing that I always emphasize is the fact that it's not just about medication. It's about, an emotional connection with someone. It's about having a connection with a higher power. And people may believe or not believe, and that's okay. You want to believe in a vacuum cleaner, that's on you. But it's always nice to have something that you can say, something better, something more. I have to take care of myself, and that's where the physical part comes in. And I think, Matt, you're absolutely correct. We are very blessed because people can go out, they can go for walks, they can exercise, they can do a number of different things, and we live in an amazing place. And I think that if we are able to join the three of them together, that's where holistic approaches can be.
Well, thank you both for joining me today, Matthew. I appreciate your time and help on the clinical side, Dr. Alva, especially on the medical side. For everybody watching this and may have further questions or kind of want to look for some guidance, please feel free to reach out to us. Thank you for joining us.
Thank you.